Good morning, everybody. Nice to see you all again today. Today we are going to talk about vaccine against chickenpox, right, Dr. Benjamin?
Yes, we are.
Okay. Uh, Actually, chickenpox was first found in the 16th century, and it has always been there, affecting worldwide populations until now. So maybe today we talk about what is chickenpox, and how it get treated or prevented. Okay.
Sure.
So shall we begin after that?
Let's go. Good morning, everyone. Welcome back to our serial lecture. This Saturday morning, we're going to talk about chickenpox this time around. So what exactly is a chickenpox? It's the same thing what probably your mother or your parents have told you or grandparents have told you in the past. It's actually caused by a little virus known as varicella-zoster virus. It's highly contagious. It affects all groups, all races, all sex, and probably you all will also know that it's actually more common in children.
那什么是水痘呢？其实水痘是一种由水痘带状疱疹病毒传染的疾病，它是非常的具高的传染性。虽然说它通常是感染孩童，但对于其他的年龄群，不管男性、女性或者是其他的种族，它还是会无差别的感染。So how is chickenpox spread?
Chickenpox is spread by two means. Number one is from the droplets of when you cough, when you sneeze, those air droplets. So if someone that has chickenpox and they cough, they sneeze on you, that's one of the ways they can transmit or spread the thing to you. Number two is direct contact. You will notice that a lot of times we ask about blisters, when the blisters are going to heal. The fluid in the blisters are the one that also spread the chickenpox around. So any contact with the fluid in the blister, and the next person come in contact with those fluids, those are how they get spread as well.
那水痘是怎样传染的呢？通常它是通过人与人之间的接触传染的，又或者人与感染者之间的异物或者身外物的接触而感染的。除此之外，如果感染者咳嗽或者是打喷嚏，它会将病毒带上空气，从而由空气传染。就当你跟感染者有亲密的接触或的话，你就会有感染的风险。So if I'm infected with chickenpox, so what are the symptoms?
All right, let's start off with the first step. So let's say you are exposed or come in contact with some chickenpox.
Okay.
It takes up to 1 to 3 weeks for the symptoms to appear. So the three common symptoms that they may have is rash, fever, and fatigue. And after that, some of them have headache and coughing as well.
So quite common
Yes,
symptoms.
correct.
Okay, so 当你接触了水痘感染的病患之后，通常它会有1至3个星期的潜伏期。所以当你开始感觉发烧、头疼或者是咳嗽的话，它的症状一开始会发烧、头疼或者是咳嗽。但在第2天过后，它会开始会出现一些皮疹，就泡状的皮疹，而且慢慢它会变得干，就在那时候它变得干燥的时候是最具有传染性的时候。What are the danger with the chickenpox?
Okay, Chiu. The chickenpox, I think I have it when I was young.
Okay,
I have it. You have it too. So we both survived. So probably 80% or 90% is actually very mild. We both recover from it. But what are the dangers with chickenpox is some of them where the virus become too aggressive. So one of the things that you may have is number one is the skin. Those blisters and all that, they may turn into a full-blown infection. So you end up with severe skin infection. That's number one. Number two, as the virus get more and more and they become aggressive for unknown reason, and it can lead the whole virus to go into your bloodstream. Those are called as blood infection, or more commonly is known as sepsis. Thirdly, chickenpox virus actually affects your lung, and they can actually be there and cause pneumonia or a lung infection. Lastly, this is more common in children, but however, it does happen in adults on a rare basis. It's an infection of the brain or inflammation of the brain. We call it encephalitis. So these are the dangers of chickenpox that we are worried about as doctors.
那水痘会对人体带来什么危险呢？其实水痘这种疾病呢，它是一种自治性的疾病，那就是说，如果你在免疫功能良好的情况下，它是会自行痊愈的。 但其实还有少部分的人会产生一些比较严重的并发症。那有什么并发症呢？其实第一，就比如说在皮疹附近产生一些皮肤的感染，就是由细菌而产生的皮肤感染。还有的就是如果细菌成功进入了身体血液里面，会造成菌血症或者是败血症，这些都是非常严重的并发症。除此之外，当那个水痘的病毒对肺部的细胞或者是脑的细胞产生攻击的时候，就会产生肺炎又或者是脑炎，这些都是属于比较少部分但严重的并发症。So when should I see my doctor immediately if I'm infected with chickenpox?
This is where I came up with a list as Chu was asking, when do you should immediately see a doctor? This is because the list that I showed you in your previous slide, the complication. So I'm just going to list out a few symptoms that you should keep note. If anyone
如果你家里有年幼的孩童，小于6岁的孩童对不起，小于6个月的孩童，或者是你有一些免疫功能低下者接触到水痘病患而产生一些水痘的症状时，就必须立刻就医，因为他们的免疫系统还没有不足以给予他们足够的保护来对抗这个水痘的病毒。Okay, so how do we treat chickenpox?
One of the first steps is definitely what you and mom gave to me in the past. It's just symptomatic treatment. And like I said earlier, chickenpox are very mild. So if you have fever, we give you medication like Panadol to reduce your fever. If you have cough, we give you cough suppressant, things like that. But one of the things in drugs that we can use is a thing called antiviral. One of the examples is acyclovir. It's specific for chickenpox. What it does, it's not exactly a cure, but it sort of reduces the virus to replicate or the virus to get in a larger amount. So which is why it's very important if you are diagnosed with chickenpox, you need to come in early because this antiviral is best if you start it early. And the other thing that you can do is if you are exposed or you are having chickenpox, you can even get a vaccine, a chickenpox vaccine. That will also a way to reduce the severity and the symptoms for chickenpox as well.
So 如果染上了水痘该如何治疗呢？通常其实正如我刚才所说，水痘是一种自治性的疾病，其实我们只是通过一些支持性的治疗或者是症状上的治疗就足够了。还有的话，我们还可以通过一些抗病毒的药，英文全名为 acyclovir， 它是一种抗病毒药，它不是一种它是一种药该怎么说呢？它是一种抗病毒的药，它让你的症状可以大大的减缓你的症状。除此之外，还有一种更有效的治疗方法，就是通过疫苗的注射，让你减少感染的风险。So what you shouldn't do if you have chickenpox?
Again, I came out with a checklist for you all. If a person gets chickenpox, please remember, number one, do not take a drug called ibuprofen. It's a painkiller. It's called NSAID. Don't ever take that. Number two, do not give aspirin to children that's under 16 years old because these two will cause complication and sometimes severe skin reaction to those people that take that. And lastly, if you have chickenpox, avoid being around those pregnant mothers or pregnant women, newborn babies, and those are in the immunocompromised state. Those that has undergoing chemotherapy, those that have HIV, diabetic. Please stay away from them.
如果你不幸感染了水痘，那你应该有什么避忌呢？其实，如果你感染了水痘，应该避免使用一些非类固醇类的防炎药，就比如说还有就是阿司匹林。如果你感染了水痘，就尽量避免在孕妇、新生儿或者是免疫功能低下者的周围接触他们，因为在他们的免疫系统是属于是比较弱，而且他们如果不幸感染上了，他们的并发症会比较严重的。 So Dr. Ben, do you mind tell us about the chickenpox vaccine?
All right, one of the ways to prevent chickenpox is actually doing a chickenpox vaccine. What is the content of it? Is a live attenuated varicella vaccine. What it means is inside the vaccine there's a weakened form of the varicella virus or the chickenpox virus. In short, it's actually very safe and it's effective, and we give it to children as well, part of the immunization program.
那什么是水痘疫苗呢？其实水痘疫苗是一种减毒性活疫苗，就是说，它其实是一种水痘的病毒，但是经过多番的处理，让它的毒性减得最低，再将它放入人体中，让人体的免疫系统自行产生抗体，所以他说它其实上是非常的有效，而且安全的。So who needs the chickenpox vaccine?
Like I said earlier, young children, they require chickenpox vaccine to protect themselves. Any older children that hasn't been vaccinated before, and any adults, number one, they're unvaccinated and never had chickenpox before. And lastly, I call them high-risk individuals, not because they're high risk, but things like you and me, healthcare workers that never had chickenpox before, kindergarten teachers, those are the ones that, like I say, may expose to chickenpox. You need to take them.
那谁需要注射水痘疫苗呢？其实我们会建议年幼的孩童接受疫苗的注射，又或者是还没有注射疫苗过的孩童，或者成年人。如果你是属于高风险群，就比如说医护人员、老师，特别是幼儿园老师，我们都会建议你注射疫苗，因为你们是属于比较高风险感染上水痘的疾病。So who shouldn't get the vaccine?
Back to the few slides earlier, I think one of the things that you need to know is because of the weakened virus. So these 4 people, they shouldn't get vaccine. Number one, pregnant women. All pregnant women should not get chickenpox vaccine. Anyone that's immunocompromised, what it meant is those that are undergoing chemotherapy, HIV individual, or those have very weak immune system, they shouldn't get this vaccine. And anyone that's allergic to both gelatin and neomycin shouldn't get it because these are the 2 contents are in the vaccine.
那谁不应该注射水痘疫苗呢？如果你是孕妇或者是免疫功能低下者，都不应该接受疫苗的注射。免疫功能低下者就比如说癌症患者、艾滋病患者、糖尿病患者，如果你都不应该接受水痘疫苗的注射，因为它是刚才我所说它是减毒性活疫苗，所以如果你免疫功能不足够，它可能会造成水痘的感染。除此之外，如果你对于明胶或者是某种的抗生素有过敏的反应，你也不应该接受疫苗的注射。So we have been talking so much about the vaccine and the chickenpox and the vaccine. So why is it so important that we get vaccinated?
Okay, this is the data that is being collected in the United States. Unfortunately, Malaysia, we don't have this sort of data, but it's the same. So what they did over there was they collected data before the vaccination began. And after they collected the data again after everyone started the vaccination. What they realized is there's a lot of death being prevented. That's number one. There's fewer hospitalization, and almost 3.5 million people has prevented from getting chickenpox. That's a big number. But in fact, what this number to me is not that significant. But what is significant is chickenpox actually saves life. Because I mentioned the complication just now. That's what we worry about. And it prevents the seriousness of the disease if you get it. So you're not sick, it doesn't complicate you, and that's what we want.
那注射疫苗为什么那么重要呢？其实，在一项美国的研究数据里显示，在实行疫苗的注射之后，它成功减少了80至90%的感染率、死亡率。所以从这里你可以看到，当这个疫苗的重要性，如果在注射疫苗过后，它成功减少了大概80到90%的人感染疫苗，从而减少了它的并发症。 So how is chickenpox vaccine given?
Chickenpox vaccine is given into two groups in a sort of slightly different way. If it's both are 2 doses series, and for young children, the first dose they give it when they are 12 to 15 months old. The second dose they give it at the age of 4 to 6 years old. That's for the young children group. But for you and me, adult, it's 2 doses again. After you take the first dose, then 4 to 8 weeks later, you take the second dose.
I see. Okay. So 如果你有兴趣想要知道水痘疫苗注射的疗程呢，其实它是分为两次的注射。如果基于的是新生儿呢，第一次的注射是在第12个到第15个月过后，就是你出世的第12到第15个月过后，你开始接受第一次的疫苗注射，然后第二次的疫苗注射呢是在大概4至6岁的时候接受。如果是成年人呢，也是两次的疫苗注射，就是第一次跟第二次的疫苗注射，就大概需要相隔4到8个星期。Okay, I think this is the end of our presentation. Then now we go with the question and answer.
Sure.
Okay, let's see the first question.
Alright.
Can I take chickenpox vaccine if I'm exposed?
Jill, yes, you can. Even let's say you're exposed to chickenpox or you're starting to have chickenpox in the early stage, you can take a chickenpox vaccine. In fact, it's indicated and it actually reduces the severity. It reduces the complication of the chickenpox. Yes, you can.
OK， 如果你已经接触了水痘的患者过后，你还是可以接受疫苗的注射。其实疫苗注射它可以减少你在感染过后产生的一些减缓它的症状，以一些减少感染的并发症。OK.
Yep.
So now we go with the second question. I have shingles before. Can I take this vaccine?
Okay, this is a no to the question that's been asked by one of the online. I have shingles. When you have shingles means you already have varicella-zoster, so it's a bit pointless to take the shingles. To take the chickenpox vaccine anymore. So you don't have to take this for shingles.
OK. 如果你曾经患有带状疱疹的话，其实你就不需要再接受疫苗的注射，因为你身体其实在你身体里面其实已经有对水痘病毒的抗体。Okay, now go with the third question. Can a history of chickenpox infection confirms my immunity?
Yes, if you have a detailed history, you know what happened, especially you know that you have fever, you have itchy rash, you have blister. Yes, those will confirm that you are actually immune to chickenpox.
如果你很确定了你曾经患有水痘的话，就代表你已经对水痘有免疫了，你就不需要再接受水痘疫苗的注射。Okay, then we continue with the fourth question. I'm 40 years old and never had chickenpox. My doctor kept on advising me to get a chickenpox vaccine. May I know why?
Okay, what that doctor did is actually correct. I think you just want to take care of your well-being, because when you are at 40 years old and you never had chickenpox before, if you manage to get a chickenpox, your symptoms are very severe, and also complications may be there as well. And of course, I think one of the things he's trying to prevent you is also to get shingles when you get older. So that's why that doctor keep on advising you to get the chickenpox, and I think he's right.
Okay. 那问题是如果我已经40岁了，没有感染过水痘，为什么我的医生还是建议我注射水痘疫苗呢？其实相比于孩童，成年人在感染上水痘后，他的症状是非常非常的严重，他发烧、皮疹都是非常的严重，而且是非常的不舒服。所以如果你还没有感染到在你40岁的时候还没感染上水痘的话，其实只是建议接受疫苗的注射，从而减低你感染的风险，而且你的症状。除此之外，其实如果你接受疫苗的注射的话，你还可以减少感染带状疱疹的风险，从而减少感染它的并发症。Okay. So I think that's all for today's session. Thank you everyone for watching.
Thank you everyone.
Thank you. Bye.
Bye bye.